The experience of pain is often described as a signal, a warning mechanism evolved over millions of years to alert the biological system to potential damage. Yet when it comes to the specific and often debilitating condition known as sciatica, particularly in the aging demographic, this signal transforms from a helpful alert into a persistent barrier to the quality of life. To truly understand how to unlock the sciatic nerve and restore mobility, we must first embark on a microscopic journey into the architecture of the human spine and the specific physiological changes that occur as the body matures past the age of 60. The sciatic nerve is not merely a single thread, but the longest and widest nerve in the human body, a complex bundle of fibers that originates from the lumbosacral plexus, specifically emerging from the nerve roots of L4 through S3. It runs deep within the buttock, beneath the powerful gluteal muscles, travels down the posterior aspect of the thigh, and eventually branches into the tibial and common fibular nerves that innervate the lower leg and foot. It runs deep within the buttock, beneath the powerful gluteal muscles, travels down the posterior aspect of the thigh, and eventually branches into the tibial and common fibular nerves that innervate the lower leg and foot. This loss of disc height causes the vertebrae to settle closer together, effectively shrinking the intervertebral foramen, the bony windows through which the nerve roots exit the spinal column. When these windows narrow, the nerve roots are compressed, leading to a cascade of inflammatory responses that the conscious mind perceives as that distinct, electric shock-like pain radiating from the lower back down to the leg. This physiological compression creates a localized ischemic environment, meaning the blood flow to the nerve itself is restricted, depriving the nerve fibers of essential oxygen and nutrients needed for repair and signal transmission. The result is a nerve that is hypersensitive, chemically irritated, and mechanically tethered. In a healthy state, nerves are meant to slide and glide effortlessly between muscles and facial sheaths as the body moves. However, in a state of chronic inflammation and compression, adhesions can form, essentially gluing the nerve to adjacent tissues. This tethering means that every step, every forward bend, and every shift in posture pulls on the inflamed nerve rather than allowing it to glide, perpetuating a cycle of pain and muscle guarding. The body, in an attempt to protect the area, reflexively tightens the surrounding musculature, particularly the piriformis muscle, the hamstrings, and the quadratus lumborum. While this muscle guarding is well-intentioned by the central nervous system, it creates a secondary layer of compression, often referred to as piriformis syndrome, which mimics and exacerbates true spinal sciatica. For the senior individual, this creates a terrifying feedback loop where movement causes pain, leading to a sedentary lifestyle, which in turn leads to further muscle atrophy, stiffness, and increased compression. Breaking this cycle requires a scientific approach that prioritizes decompression and the restoration of nerve mobility over forceful strengthening. We must understand that the sensation of relief does not come from forcing the spine into alignment, but from creating micromillimeters of space within the spinal architecture. The concept of nerve flossing, or neural gliding, which will be the basis of our remedial movements, is rooted in the principle of mobilizing the nerve to break adhesions and pump lymphatic fluid around the nerve root to flush out inflammatory cytokines. This is not about stretching a muscle until it yields. Nerves do not like to be stretched like rubber bands. Instead, the goal is to gently floss the nerve through its pathway, coaxing it free from the surrounding soft tissue restrictions. Furthermore, we must consider the systemic environment of the elderly body. With age, the water content of the body decreases, making facial tissues more rigid and less pliable. This systemic dehydration affects the discs, the fascia, and the protective sheaths of the nerves. Therefore, the approach to healing sciatica in later years is as much about hydration and fluid dynamics as it is about mechanical movement. The movements we prepare to undertake are designed to act as a pump, encouraging the rehydration of these parched tissues. It is also crucial to acknowledge the psychological component of chronic sciatic pain. Long-standing pain sensitizes the central nervous system, lowering the threshold for pain signals, a phenomenon known as central sensitization. The brain begins to interpret safe mechanical signals as dangerous pain signals. By engaging in slow, controlled, and deliberate movements, we're not only treating the physical nerve but also retraining the brain. We are sending safety signals through the nervous system, utilizing the parasympathetic state to dampen the fight-or-flight response that often accompanies chronic pain. This neurological downregulation is essential because high levels of stress hormones like cortisol can actually increase systemic inflammation and pain sensitivity. Thus, the foundation of our protocol is built on the understanding that we are treating a whole person, navigating the complexities of an aging skeletal structure, a dehydrated facial system, and a sensitized nervous system. The 5 postures we will explore are not arbitrary. They are biomechanically selected to open the specific pathways of the L4, L5, and S1 nerve roots, rotating the pelvis and creating space in the posterior chain without placing dangerous loads on the fragile lumbar discs. We are preparing to unlock the body's intrinsic ability to heal by manually overriding the mechanical faults that have developed over time. As we transition from understanding the why to executing the how, remember that the objective is precision and patience, respecting the decades of life your spine has supported. Having established the physiological landscape of the sciatic nerve and the unique challenges presented by the aging spine, we now transition into the practical application of this knowledge through 5 specific, scientifically grounded postures designed to create immediate decompression and restore neural gliding. It is imperative that these movements be performed with a mindfulness that borders on meditation, as the difference between a therapeutic stretch and an aggravating injury often lies in a matter of millimeters and the quality of breath work employed during the execution. The first posture, often considered the gold standard for relieving piriformis-induced sciatica, is the modified supine figure 4 stretch. This position is chosen specifically for the elderly demographic because it is performed lying on the back, which completely offloads the force of gravity from the lumbar spine, providing a safe environment for the vertebrae to separate. To begin, you lie flat on a firm but comfortable surface, perhaps a yoga mat or a carpeted floor, with your head supported by a thin pillow to maintain cervical neutrality. You bend both knees, placing your feet flat on the floor, hip-width apart. The movement begins by lifting the affected leg and placing the ankle across the opposite knee, creating a triangular shape with your legs. At this very moment, the hip undergoes external rotation, a movement that directly influences the tension in the deep gluteal muscles. For many seniors, simply resting in this position is enough to feel a gentle opening in the hip. However, to access the deep piriformis muscle that may be strangling the sciatic nerve, one gently lifts the foot of the uncrossed leg off the floor, threading the hands around the back of the thigh to draw the legs toward the chest. As you pull the legs closer, the piriformis muscle is elongated, and because the spine is neutral on the floor, there is no risk of flexion-based discompression. The sensation should be a dull ache or a feeling of release in the buttock, never a sharp pain. You hold this position, breathing deeply into the lower belly, imagining the breath expanding the lower back against the floor for at least 30 to 60 seconds, allowing the mechanoreceptors in the muscle to signal the brain to release tension. Transitioning seamlessly from this hip opener, we move to the second key posture, the single knee to chest decompression. This movement is deceptively simple but mechanically profound. While still lying on your back, you extend one leg flat against the floor, engaging the heel to anchor the pelvis. You then draw the opposite knee toward your chest, clasping your hands around the shin or behind the thigh if knee flexion is limited. This action creates a posterior pelvic tilt on one side, which mechanically opens the intervertebral foramen, the exit windows for the nerve roots, specifically in the lower lumbar segments where sciatica often originates. By keeping the head and shoulders relaxed on the floor, you isolate the stretch to the lower back and gluteal region. The key here is not how close the knee gets to the chest, but the elongation of the lower spine. Imagine the tailbone lengthening away from the crown of the head. This posture serves as a manual pump for the lower back, flushing out stagnant fluids and introducing fresh blood flow to the lumbar region. From this supine position, we carefully transition to a seated orientation for the third posture, the seated hamstring neural glide. The hamstrings are often the culprits in perpetuating sciatica because when they are tight, they pull down on the sit bones, locking the pelvis in a position that compresses the lower back. However, traditional standing toe touches are dangerous for seniors with sciatica as they place immense pressure on the discs. The seated variation eliminates this risk. You sit on the edge of a sturdy chair, extending the affected leg out straight with the heel on the floor and the toes pulled back toward your shin. This dorsiflexion of the foot is the critical component that turns a muscle stretch into a nerve glide. Keeping the spine perfectly straight, visualizing a rod running through your vertebrae, you hinge forward slightly from the hips, not the waist. You may only need to move an inch or two before feeling a significant pull along the back of the thigh. In this position, we introduce the dynamic flossing motion. Inhale and point the toes away. Exhale and pull the toes back toward the knee. This pumping action creates a sliding motion of the sciatic nerve within its sheath, breaking up microadhesions without straining the back. We repeat this rhythmic flossing for 10 to 15 cycles. Following the neural glide, we address the position of the pelvis with the fourth movement, the standing pelvic tilt. Many seniors suffer from an excessive arch in the lower back or a flattened lumbar curve, both of which reduce the space for the nerves. Standing with your back against a wall, feet a few inches away, you soften the knees. The objective is to use the abdominal muscles to gently press the small of your back flat against the wall, reducing the gap between your spine and the surface. This voluntary posterior pelvic tilt actively opens the facet joints of the spine and elongates the lumbar region. It is a subtle, internal movement that strengthens the deep core muscles while simultaneously decompressing the nerve roots. Hold the compression against the wall for 5 seconds, then release, repeating this 10 times to reprogram the posture. Finally, we conclude with the fifth posture, the gentle standing extension. Chronic sitting encourages the spine to curl forward, pushing disc material backward onto the nerves. Extension reverses this. Standing with feet hip-width apart, place your hands on your lower back, just above the waist, fingers pointing down. With a slow inhalation, gently arch backward, looking up slightly toward the ceiling while supporting your spine with your hands. This is not a deep back bend, but a subtle counter-stretch to the forward flex posture of daily life. It helps to centralize the disc material, moving it away from the nerve roots. This sequence of 5 movements, rotation, flexion, neural gliding, pelvic alignment, and extension, covers every biomechanical angle required to free the sciatic nerve. Each move builds upon the last, treating the hip tightness, the spinal compression, and the nerve tethering in a systematic order. By performing these movements sequentially, you are essentially unlocking a combination safe, where each number must be dialed in precisely to release the door. In this case, the door to a pain-free existence. Once the mechanical work of the 5 postures has been completed, the body enters a critical window of physiological integration, a phase that is just as important as the exercises themselves for ensuring that the relief obtained is not merely transient but cumulative and lasting. The immediate sensation following the decompression routine is often one of lightness or a reduction in the sharp, electric quality of the pain, but to maintain this state, we must understand the biological requirements of nerve healing and the role of lifestyle in preventing recurrence. The sciatic nerve, like all nervous tissue, has a high metabolic demand. It requires a significant amount of oxygen and glucose to function correctly and to repair the myelin sheath, the protective coating that insulates the nerve fibers. When we finish stretching, the blood flow to these areas is temporarily increased, a phenomenon known as reactive hyperemia. To capitalize on this, it is essential to engage in gentle, non-percussive movement immediately following the routine, such as a slow walk around the house or the garden. Walking is the natural functional movement that integrates the gluteal muscles and the lumbar spine, teaching the body to utilize the newfound range of motion in a practical setting. The sciatic nerve, like all nervous tissue, has a high metabolic demand. It requires a significant amount of oxygen and glucose to function correctly and to repair the myelin sheath, the protective coating that insulates the nerve fibers. When we finish stretching, the blood flow to these areas is temporarily increased, a phenomenon known as reactive hyperemia. To capitalize on this, it is essential to engage in gentle, non-percussive movement immediately following the routine, such as a slow walk around the house or the garden. Walking is the natural functional movement that integrates the gluteal muscles and the lumbar spine, teaching the body to utilize the newfound range of motion in a practical setting. Furthermore, we must address the systemic inflammation that often underpins chronic sciatica. While mechanical compression is the spark, inflammation is the fuel that keeps the fire burning. An anti-inflammatory approach to nutrition becomes a pillar of long-term pain management. This involves reducing the intake of processed sugars and inflammatory oils, which can heighten the body's pain response, and increasing the intake of omega-3 fatty acids and antioxidants, which support nerve health. We are essentially trying to change the chemical bath that our nerves are soaking in, moving from an acidic, inflammatory environment to a neutral, healing one. Beyond diet and hydration, the position in which we sleep plays a massive role in whether the nerve heals or becomes re-agitated overnight. For a sciatica sufferer, sleeping on the stomach is often the most detrimental position, as it forces the spine into hyperextension and twists the neck, creating torque throughout the spinal cord. The optimal recovery position is side sleeping with a thick pillow placed between the knees. This pillow is crucial. Without it, the top leg slides forward and down, pulling the pelvis into rotation and placing tension on the piriformis muscle and the sciatic nerve all night long. By keeping the knees parallel, we maintain a neutral pelvis, allowing the work done during the day to settle and integrate during the restorative phases of sleep. Another overlooked aspect of recovery is the management of sitting habits. Sitting is the new smoking for spinal health, as it increases the pressure within the lumbar discs by up to 40% compared to standing. For the senior individual, breaking up periods of sitting every 20 minutes is vital. It does not require a workout. Simply standing up, engaging the glutes, and shifting weight is enough to reset the pressure within the discs. This constant variation of posture prevents the creep phenomenon, where tissues slowly deform under sustained load. Finally, we must return to the concept of neuroplasticity and the brain's role in pain. Chronic pain creates a memory trace in the brain. The neural pathways associated with pain become well-trodden highways. Even after the physical impingement is resolved, the brain may continue to generate pain signals out of habit. This is why the practice of relaxation and positive visualization is a tangible part of the cure. By consciously focusing on the sensation of relief, by visualizing the nerve as a smooth, flowing river rather than a pinched wire, and by practicing deep diaphragmatic breathing, we stimulate the vagus nerve. This activation promotes the release of endorphins and encephalins, the body's natural painkillers, and helps to rewrite the neural code, fading the memory of pain and reinforcing the sensation of safety and mobility. The journey to healing sciatica is rarely a straight line. There will be good days and challenging days. However, by understanding the anatomy of the aging spine, applying the precision of the 5 key stretches, and supporting the body with proper hydration, sleep mechanics, and a positive neurological focus, we're doing far more than treating a symptom. We are empowering the body to reclaim its function. The goal is not to have the spine of a 20-year-old, but to have a spine that supports a life of joy, independence, and freedom of movement. We are unlocking the potential that resides within the body, proving that age is not a sentence to suffering, but a stage of life that, with the right care and knowledge, can be navigated with grace and vitality. This comprehensive approach, blending the mechanical, the chemical, and the neurological, offers the most robust path out of pain and back into the rhythm of life.